actually like the best conference I think I've ever been to. All of the speakers have been amazing.
Today has been educational and mind-opening and inspiring.
Today's conference brings together professionals, practitioners and community organisations working to improve LGBTQ+ health and wellbeing across Calderdale and Kirklees. Themes include smoking cessation, outreach, safer relationships, pride and community connection, drugs and alcohol, chemsex and more.
Well Proud project is so important. They branch out in so many different areas, from our physical health to our mental health, to help educate the community.
I think it's really important to have these events, really for visibility. I think we've shown locally how well we all work together to really influence change and improve outcomes.
We were so excited to have the opportunity to work together, so Women's Centre and Brunswick. Level is a trial programme supporting LGBTQ+ people where there is harm in intimate relationships. Working with people who cause harm is a vital part of prevention. It's the other side of the coin, isn't it? We want to support people who are victims, but if we don't address the root cause, nothing will change.
I think it's absolutely amazing, all the different projects that are going on under the Well Proud banner.
A big portion of our presentation today was stigma related.
People need to be aware that people living with HIV on effective treatment cannot pass that virus on.
A lot of people living with HIV still experience the same stigma as there was in the 80s. That has a knock-on effect to every aspect of people's lives, from accessing treatment to adhering to medication, to accessing HIV support, all the way through to accessing the other organisations that are here today.
I think any community can get left behind and can fall through the gaps. Accessing universal services, just your basic healthcare, it's just really important to make sure that we reach out to everyone and everyone has those same opportunities.
One thing that I did learn was about checking for breast cancer, cervical cancer within the trans community. It was something, even though I'm a part of the community myself, it was something that never even came into my sphere of thought. So when I was listening to it, it absolutely blew me away, because I was like, oh my God, why have I never thought of this before?
We wanted it to be informal, so there were postcards designed to be like merchandise with the fruit on them, and then on the back you scan the stamp, which is the QR. It takes you to our website where there is LGBTQ+ specific information. For example, links to websites around how to examine your chest if you're a trans man, around how to manage dysphoria if you're going for a cervical smear.
Specific LGBTQ+ wellbeing projects are so important because LGBTQ+ people have specific needs that need to be met.
The Brunswick Centre has been absolutely brilliant. The collaborations that they're doing with other organisations to create that support that is needed for the LGBTQIA community is absolutely amazing. And they're having the speakers coming from the front line, and I think that's amazing because that's not often you get that at conferences.
If there are gaps in services, for sure, sex workers are falling through them the deepest.
I've learned useful information around sex work and how we need to engage sex workers and really to get their voices elevated to really improve things for them.
Basically, I'm just here to sort of talk about my experiences with the services that I've interacted with. Mainly, I wanted to start with Broad Street, getting sexual health testing.
We've got so many different pockets of information, from HIV through to stop smoking, through to the domestic abuse programmes, but actually sex work isn't directly embedded into any single one of those. So the fact that it's such a big area that we don't quite have that expertise on, and that they've come and highlighted today, particularly Kim with all that lived experience, was amazing.
That body of work doesn't exist as such until everybody kind of gets together and connects together and finds a way to make that happen.
All of the Pride committees that have taken the time to be here today, the smaller grassroots Pride like Home Firth, what they pulled together in 6 weeks was magic.
Unfortunately, last year in April in 2025 in Home Firth, a young lad was violently assaulted in a homophobic hate crime in the centre of Home Firth. It was absolutely shocking and really shocked us as a community. It was something we kind of thought as a group, we're not having this in our community. So we organised a Pride event in 6 weeks on £2,500 and a lot of goodwill.
I feel proud that we can still live in a society where we can all come together and be who we are.
We came up with the mission to eradicate transphobia, biphobia and homophobia via art and education. We soon started delivering a week-long queer arts festival, year-round events and an award-winning youth engagement project.
I'm also really proud of having the privilege of working with young people to helping them discover their own identities.
We work with over 20 schools and youth groups in Calderdale from the ages of 5 right the way through to 18, and in the last 5 years we've managed to have meaningfully impacted on over 10,000 young people.
We try and run Calderdale Pride not just for the one day, but for the whole year. So we work with people like Brunswick with the testing and signposting. The Mission Zero project was incredible when they came to Pride.
What makes me feel well proud is working for a really cool charity like Brunswick and getting to work with all the other cool people here today. John Fox from Hep C said it best when he said we're going to get the best outcomes by working together as community organisations.
Mission Zero's work and the Hepatitis Trust aims, so the aims of Mission Zero were to end new HIV/TB viral hepatitis transmissions, stopping preventable deaths and eliminating associated discrimination and stigma in Calderdale by 2030.
Projects like the Brunswick Well Proud project are so crucial.
It's been really good as this drag project that it's brought us all together to work specifically around communities, around drug use and alcohol with LGBTQ communities. There were a real need there, and there still is. There's still a lot to be done, but at least we made a good start.
A key part of what we do is actively challenging stigma, breaking down barriers that prevent people from accessing support, whether that's through fear, discrimination, past trauma or systemic inequalities. So ultimately our role is about supporting and working in a compassionate, trauma-informed way, keeping people safe, reducing harm and opening doors to recovery in ways that feel accessible and non-judgmental.
We support young people with their substance use, making sure that they are informed for the issues around it and get facts.
LGBT communities can feel a lot of minority stress, ongoing discrimination or stigma, family rejection, mental health struggles and trauma.
I think it's really important, particularly for cisgendered and straight colleagues and people working in frontline services, to understand the unique needs and challenges that LGBTQ plus people face.
LGBTQ plus people are 46% more likely to smoke than the general population. What we know out of that number, though, is that 86% of those would actually like to quit smoking. Working with the Brunswick Centre and the public health team in Calderdale and Yorkshire Smoke Free, this is where we came up with linking together on the Queer as Smoke campaign.
What makes me feel well proud is the level of work that the Brunswick Centre does for the community, just really understanding health inequalities and the impact of those.
Seeing queer people thrive makes me feel really proud.
The fact I overcame addiction and created a support pathway for individuals that are struggling with chemsex. So that makes me well proud.
I'm a writer, a performer, an activist, and today at the conference I'm performing an exclusive work in progress sharing of my new show, A-Hole, which is the third show I've made about my own life story, and it's all about the journey to finding true pride after sexual trauma.
What makes me feel well proud is intersectionality, and it's something that we're seeing at the conference here all day. It's different organisations working with each other towards the common goal of helping LGBTQ plus people thrive and live healthy and happy lives, and that makes me so proud.
When you come to events like this, you can really see that there is that support, and it gives you hope for the future that we will make the change and we will make the world a more inclusive place.